Here's a shocking truth. The very committee tasked with guiding our nation's vaccine policies is embroiled in heated debates, with experts clashing over transparency, scientific rigor, and the future of public health. But here's where it gets controversial. The Advisory Committee on Immunization Practices, ACIP, recently overhauled by Health and Human Services Secretary Robert F. Kennedy Jr., is now navigating a minefield of differing opinions, leaving many to wonder. Are these changes in the best interest of public health, or do they signal a shift in priorities? And this is the part most people miss. The committee's decisions, which must be approved by the CDC director, have far-reaching implications for vaccine recommendations, yet the process itself is under scrutiny like never before. On day 2 of their meeting, ACIP members and outside experts locked horns over the decision-making process, with some calling for greater transparency and others questioning the scientific basis of recommendations. Here's the kicker. The committee's recent shakeup, with Kennedy appointing allies and known vaccine critics, has raised eyebrows and sparked concerns about the direction of future guidance. Could this be a turning point in how we approach vaccine policies? One of the most contentious issues was the hepatitis B vaccine. The committee unanimously voted to test all pregnant women for hepatitis B, a move aimed at reducing mother-to-child transmission. However, the decision to table a vote on potential changes to the pediatric vaccine schedule has left many wondering about the implications for infant health. Dr. Robert W. Malone, an ACIP member and Kennedy ally, argued that a vote was premature due to lingering questions about safety and effectiveness. But is this caution justified, or does it delay critical protections for vulnerable populations? The debate over the hepatitis B vaccine highlights a broader tension, balancing the need for robust scientific evidence with the urgency of protecting public health. Dr. Amy Middleman, a liaison for the Society for Adolescent Health and Medicine, urged the committee to use a methodical scientific approach, while ACIP member Retzef Levi questioned the confidence of some speakers in the absence of long-term clinical trial data. Is this a healthy debate or a sign of deeper divisions within the committee? Adding to the complexity, the committee is also expected to consider COVID-19 vaccine recommendations, including potentially narrowing the list of high-risk conditions. This shift could reduce the number of people recommended for vaccination, even if they might still benefit. But here's the million-dollar question. Could this send the wrong signal to the public, eroding trust in vaccines and undermining efforts to protect maternal and pediatric health? The inclusion of healthy pregnant women and infants in the high-risk category has long been a cornerstone of vaccination policies. Yet some experts worry that removing these groups from recommendations could reduce their protection and damage public confidence. The American Academy of Pediatrics and the Society for Maternal-Fetal Medicine have both emphasized the importance of vaccinating these populations, citing data on elevated vulnerability and hospitalization rates. So, why the potential shift, and what does it mean for the future of public health? As the committee continues its deliberations, one thing is clear: the stakes are high. The decisions made in these meetings will shape vaccine policies for years to come. Is the current process transparent enough? Are we prioritizing scientific rigor over political considerations? And most importantly, are we doing everything possible to protect the most vulnerable among us? These are the questions that should keep us up at night, and they're the ones we need to be asking as we watch this drama unfold. What do you think? Is the committee on the right track, or are we headed down a dangerous path? Let's hear your thoughts in the comments. This is a conversation we can't afford to ignore.